I may become a highwayman again, or I may simply be a single drop of rain, but I will remain, and I'll be back again and again.
We're 1 for 1 on the new phone line. We'll see how this goes. Sarah Overton is the Chief Nursing Officer for OSF Medical Group, Home Care and Employee Health. Sarah, good morning and happy Monday to you.
Good morning. For having you.
Oh, can you hear me okay, Sarah?
Nope.
Oh, no. Let's see what we can do here on the fly real quick to see if we can make this phone call go a little bit smoother. And, Sarah, every opportunity we get a chance to, that was very loud, we get a chance to talk to OSF Healthcare. It really is a great opportunity for us because you guys do so much here in the RiverBend region. And now can you hear me better?
I sure can, actually.
Okay, I see. That's the unwritten rule of radio right there. They teach you how just to talk until it just magically happens, you know? Well, Sarah, last Tuesday was National Healthcare Decisions Day. And right off the bat, take me through the significance of that day.
Yeah, CJ, thanks for having us. You know, at OSF, we've always tried to partner with our community to empower, engage, and educate the public about National Healthcare Decisions Day. And that is day after you submit your taxes. So if you're a little late to that, I apologize. But like the IRS, so do your healthcare workers want to know your decisions that affect you. So how your goals of care progress. Each and every one of us knows that unfortunately death is a normal process of life. And we really think it's important for us to normalize the conversation and people you love that are surrounding you, as well as the people who take care of you, to say what's important for you as it relates to your current healthcare journey. And then when the time does come that decisions have to be made about healthcare, such as feeding tubes and breathing tubes, and where do you want to be in your last several months, we can guide you along that way and talk about just those decisions and what those impacts look like. Do you want to be in pain? Do you want to be able to communicate with your family? As healthcare providers, that's really our calling, is to help our patients and to educate them on their goals of care.
And, Sarah, not, and you know this better than anyone, not everyone has the opportunity to, plan out that end of life treatment plan or how they would like to, have that, tackled. But for the families that do have that opportunity to know what decisions are being made, how much peace of mind does that bring them, in your opinion, whenever you're interacting with those families, when your providers are interacting with those families, about the importance really of those decisions and how much peace of mind comes with it?
Absolutely. So national research actually tells us that 70% of patients, the community, do not want to be in a hospital in their last few days. Unfortunately, that's about how many patients do pass away in a hospital setting. So surrounded by pretty aggressive treatments, oftentimes alone because our family can't be staying all hours. And it can be a very devastating and lasting impact emotionally with those last few memories. So what we've found is it's really nice to have the opportunity, certainly well in advance. So I happen to be a middle-aged female, and I've had this conversation with my husband and my children who are now adult age. And I've told them, if these certain situations happen, here's who my medical decision maker is. Everyone else that's around the family, I need you to understand these are my wishes, and that medical decision maker or the healthcare power of attorney is really honoring my wishes. It gives a lot of levity to the situation. It broadens the conversation, and it also allows truly our families to just embrace that experience so that no one has those hidden agenda thoughts. No one thinks, oh, so-and-so is talking, for Sarah and doesn't have her best interests in mind, because it's really my interests. And that's what we want to help inform. I've been through family situations that can be kind of, uncomfortable, and also been in a position where I've had to make decisions for someone and I wasn't exactly sure if that's how they felt. So just really talking through some of those scenarios, it often brings families much closer together and allows them to plan for who they want involved in their care at the end of their life.
And Sarah, on top of that all, when we were going through our experience with someone, with my grandfather during his, end of life, during that journey with him, we kind of were a little bit forced into the situation due to, some TIAs and some things that progressed and kind of led to that. What is your advice for families? Is there an opportunity maybe for a son or daughter, a relative, a loved one to have that conversation even while someone's a little bit more healthy? And not saying, 5-10 years, when they're 45 years old to figure that out, but to at least have a game plan. And how does that conversation happen maybe with an older adult when you're talking about that final chapter?
Yeah, great example. So again, what we've gone to within healthcare is really looked at the literature. What are the important questions, and developed what we call some questionnaires that are going to actually be available now if you sign up through OSF MyChart. So you can go in as a family together with your grandfather, a loved one, and talk through, like, okay, let's answer these questions, and rather than family game night, let's sit down and talk about, just some experiences. What would you want in these situations? And so that guided tool, really with questionnaires, helps to process that conversation a little bit more easily. Now, situations arise, certainly catastrophic health events, a trauma, so a car accident, something can happen to expedite or change the trajectory of that conversation. And that's really where your healthcare providers step in, and they'll help guide, kind of risks and benefits of different aspects. So do I want a feeding tube? What does that mean? What does my life look like if I should decide on this surgery? Or maybe there's better benefit for me not doing this surgery and holding on. So we really call those goals of care conversation. And that's really what advanced care planning is all about. It's taking your wishes of end of life and those questionnaires and bringing that in with the healthcare team to help support that. It's a very natural experience, and it really allows you to be in control of the decisions rather than just assuming that the doctor's right and knowing exactly this is the way that we would aggressively want to treat this heart failure or COPD or whatever stroke maybe that's happened. It allows you to be in much more control. And we actually see that patients have better outcomes when they are helping make those informed decisions.
Absolutely. And, Sarah, whenever we're talking with an individual, we're talking to our loved one and making those, those important decisions. What is your advice for, maybe that individual, that loved one or caregiver who's trying to have that conversation, but the recipient isn't willing to talk about that stage just yet? Maybe they aren't comfortable. Are there some resources at OSF Healthcare that maybe help aid into that conversation with that with your loved one about that final chapter if they're kind of having some abrasion to discussing it? Because for some it's hard to acknowledge that.
Absolutely. You're spot on. For me, someone who does this in the daily, it's very comfortable to have these conversations and sit bedside with the family and talk through things. Yes, we have a wealth of resources. So our OSF supportive care, if you just Google that, or if you just type that in and search, that has a wealth of tools and resources right out on the web. We also have MyChart, which we've talked through, has some of those self-guided questions. And if it's something that makes you, maybe makes that recipient, that patient themselves feel uncomfortable or awkward talking about, I always go towards the aspects. So using my father, it's the gift you are giving your family. So maybe you feel awkward and uncomfortable. Imagine how your family feels if they don't know what your answers and responses would be. So often when we talk about this is a gift that you're providing to your family, your loved ones, your friends, and putting it all down. Unfortunately, if we don't do those things, what we're left with is sometimes legal action, sometimes having to appoint a surrogate, someone who doesn't know you at all. Those are very infrequent situations, but they do happen when a loved one maybe doesn't have a lot of family around them. We have to then find someone closest to them and hope that they know what this person wants. And that's a very uncomfortable situation. So using those scenarios or, to bring a little bit of levity to the situation, maybe you don't want your wife making decisions because she's going to keep you on there as long as possible. And so having a child who is a little bit more objective, and that's what our ACP facilitators do. We have trained social worker and nurse facilitators all throughout OSF Healthcare, including our Alton market. And they also know all of those options, such as palliative care, and which is, I can't tell you, anyone that's had a very negative experience entering into hospice earlier, we know studies support how hospice care actually lengthens your life in those months.
And Sarah, we've already been talking for 15 minutes, and I really appreciate your time. But one more question I have for you, and I would love to have you back if we can set up more time to discuss this, because this could be its own show, is discussing this. Take me through, how important it is to set this up and to have these decisions made, because I could only imagine, as I'm hearing some of our conversation today, is the fact of the matter is, if we don't have this in a row, it could cause some disorganization and really some, it could make it really uncomfortable for the healthcare team that's really aiding and abetting the patient. Is that am I onto something there too? Where even though they aren't our family, they're still part of our team.
Yeah, absolutely. What we've researched and studied and know is that so many patients, again, are dying in a way in which they do not feel respected or want to die. They're also not afforded all of the options and opportunities early enough. And really, we have to normalize this conversation like years in advance and make decisions so that you do have the legal documents in place, because without a healthcare power of attorney, we have to kind of go by next of kin. And again, using the scenario of the wife, that's maybe not always the best decision. So documenting that for your healthcare team also helps us tremendously. It makes us know that we're respecting and honoring your rights, that we are bringing the right people to the conversation, that we are providing HIPAA information to them when it's time. And so those are all things that are critical to really avoid any gaps in transitions to care. So when we know that this is all down on paper and or electronically, which we have at OSF Healthcare, it helps expedite decisions, and it also ensures your hospitalist team, your primary care team, maybe hospice or palliative care team, we're all on the same page, and we know how to honor your wishes.
Absolutely. And Sarah Overton is the Chief Nursing Officer with OSF Medical Group Home Care Employee Health. Sarah, thank you so much for your time today, and I hope we get to talk again soon about this very important topic.
Absolutely. Thanks so much, CJ. Appreciate it. Have a great day.
No problem. The time is 10:25 in downtown Alton. We'll take a quick break. Our daily show continues next, right after this.